District, Congressman Lincoln Davis.
Thanks for the dedication of this group that is constantly bringing before not only those of us who serve in public office, but to the public as a whole. When we talk about health care, and how it impacts all of us, regardless of your wealth, your status, how great you think you may be in this country, or how lowly you may think of yourself. Health care has an impact on you and the inability to be able to have adequate health care. I think it's one of the biggest issues that all of us face. When I was a youngster growing up, I barely remember the scab on my arm from the shots that were given to me for smallpox. The health department came to Frogs Chapel Elementary School. It was a one-teacher school building. That is still standing. And I received a life-threatening immunization that particular day that would have kept that life-threatening disease from perhaps taking my life. One of my best buddies had polio. In the early years, after we consolidated Pall Mall and all the other different small one-teacher schools in the valley where I still live and where I grew up, I remember the sugar cube that had the salt vaccine on it. Probably may not have kept me from getting polio because at that time, well, it could have perhaps, but it didn't keep my friend from getting polio, who did survive and who still remains a good friend of mine today. We both had the same teacher, his mother, in the one-teacher school at Frogs Chapel. The health department's played a major role in health care in rural America, and I am certain it had the same role in urban America or downtown metropolitan cities. I voted for the Medicare prescription drug bill. Some of you in this room have given me grief because of that. That lady right there just confirmed. Where did she go? That her mother now pays $17 a month as a result of the prescription drug bill that she did not have before the prescription drug bill passed. When I mentioned Social Security a moment ago, it passed in 1935, I mentioned that people saw a need to reach out for the lesser amongst us. And quite frankly, I think that's what people in Congress did in 1935. Some of you may be aware that there's an attempt today to privatize Social Security, as they have continued to privatize health care in this country to where we can have it available and affordable for us. The way I would start to fix the Medicare prescription drug bill is make it a single payer and let the federal government negotiate for lower prices for seniors who live in this country. Who live in this country to be able to at least have the same method of paying rather than using some private company to pay for the services in Part D of the Medicare prescription plan. Why did that not happen? Now, I can say what I'm about to say, and some of you will think it's political, and you'll think it's a party political statement that I'm about to make. It happens to be the fact. But in 2002, the largest contributors to the Republican Party, other than themselves giving to each other, was the pharmaceutical companies. After being sworn in the first Tuesday of January of 2003, there was a Medicare prescription drug bill, and somewhere in December of 2003, we were held in the chamber from 3 o'clock in the morning until 6:15 in the morning to pass a bill when nobody was watching it to see how the arms were twisted, to pass the legislation that basically denied the Department of Health and Human Services from negotiating for lower prices for the seniors who live in this country, as the Veterans Administration does for 25 million veterans. It also required payment to be accessed through an insurance company or through a pharmaceutical company. Now, when you're sitting there and you have 28,000 people in your district who will receive reduced or no-cost prescription drugs that are over the age of 65, what do? You deny them that right? I didn't think I had the right to do that. I called my wife. She said, Lincoln, you mailed out a little flyer that said food or medicine. She said, all you politicians do that. Kind of chastised her for calling me a politician. She said, all of you do that. You see it on TV ads, you hear it on the radio, you see them mailing it out. I care for you, I care for you. I want you to be able to not have to make the choice between food or medicine. She said, you mailed that out, and some lady called me and said she voted for you on election day because she really believed you cared for her. And she said, how can you not vote for that bill? It does something, maybe not what you want it to do, but it does something. At least it starts the process. My hope is that now we can fix the prescription drug bill to where it goes single payer and negotiate for lower prices, in essence to where that it helps those who was intended to be helped, instead of those who happen to have bottom line figures on their stock market cards.